can you hear me? Dinesh, can you
Very
hear
well.
me? I'm talking to the technical chap, but he doesn't seem to be responding. We have actually
yes, sir.
5
I can.
videos lined. Yeah. So Dinesh, we will play it in the order that we spoke of.
Okay.
So once you welcomed everybody and introduced everybody knows each other, we're looking forward to hear from you. Sir, we have small videos for each one, except Dr. Khurshid, whom we couldn't get one from. So Dinesh, are you ready to start? Please go ahead.
Yes, sir.
Wonderful. Colonel Ghosh is not logged in. I will just try to get in touch with him once more. Mohan sir was our opening batsman for the videos, I see.
I mean, are you going to give me a couple of minutes, Ajay? People would not
Yes,
have
if you say so.
seen
Of course,
what
half an hour is left.
apply your tune. Anyway, I can briefly tell that I joined PGI in sometime July '86. I was working as an assistant professor of medicine at that time. Of course, PGI memories were great, even though I had tough time initially, the food was atrocious, and, but then I habituated to it, and what I still remember almost every other day is the gut butts at the statistical meeting. Once in a month, we have to do general duties, and that was the time when I had mortal fear because one of those days the cases will be coming for the statistical meeting, and we were not used to that sort of system in our college days. Well, about the faculty, all of them helped us tremendously. One of the thing I remember very vividly was during our case discussion, PLW as usual was late, and I was trying to uh, um, prove my point and was saying that the bone of contention mentioned here is when suddenly Dr. Sapru jut in and said that there is no bone, there is no contention. Mohan, stop. So those were days where we had great days, and you can only fondly remember them. And whatever we are is thanks to those institutions, thanks to your colleagues, thanks to the great teachers.
Thanks.
Do feel free to share one or specific incident, something that you really remember from your time in PGI.
You were saying something, Miraji?
No, nothing. I'm enjoying.
Okay. Now, when I came back, I was in medical college for about 10 years, and we never had a cath lab at that time. But in 2003, we set up a cath lab, and we were doing. But then I'm a jack of all trades. My possibly the only contribution at least is we started doing some registries sometime in 2000 onwards. When I became the president of the Kerala chapter, we had a good number of cardiology friends, and we thought, why not get something like a create registry? And we outbeat create. We recruited 25,000 patients of acute coronary syndrome from 125 hospitals in Kerala. And that still is the number one ACS registry in India. And that attracted a lot of attention from the others. So we started collaborating with the Northwestern University, and a couple of few guys came. They have the NHLBI grant. So we could do one of those, maybe the largest randomized control trial in cardiovascular science in India, the ACS Quality Improvement Program. That was in 2015. And we have been then that stimulated a lot of interest amongst our cardiology friends here. Now we have 16, 17 registries running by the Kerala Cardiology CSI, and the youngsters has taken it in a big way. And although I can honestly be proud. No, I possibly was the guy who started it, and then it goes on. Actually, when the PGI GAM met last year, BKS and I was supposed to do some registries on behalf of the PGI. BKS has in between and actually there was a note from him saying that we should do something like an endocarditis registry. But already the Kerala registry has endocarditis registry has some 600 patients, so it is going to be published soon. My wish will be get PCI, a registry of PCI in left ventricular dysfunction patient, CAD, LV dysfunction. No data practically from India. So if we can, Ajay and
Find
when
out from
Smith
them.
comes,
If it is not ready, we'll go. Or do you want to sit?
if we can start a
Happy to sit.
registry of
Okay.
PCI in LV left ventricular dysfunction, or even any revascularization for that matter, there is absolutely no data. That will be my hope and my wish. The PGI, our friends will start doing.
Mohan. Hi to Mohan, Robin, and Polly.
That'll be all from my side, Ajay.
Wonderful.
Don't say anything.
As I was saying,
Let them reflect.
please feel free to share any specific incident from your time at PGI. We encourage people to speak about their particular time at PGI. So if you have any incident you'd like to narrate, feel free.
Oh my God, he's saying such a lot.
Hey, Nani.
Hey, Mon, how are you? Hi,
Very
Bali.
good.
Morning.
Yeah,
I'm in Kolkata,
Good
Nani.
to-
Good.
good to see you guys.
Okay.
All right.
Can I talk?
Please go ahead.
Nani just reminded me the way we used to cook food in his room on kerosene stove, I think. Which one it is easy to Onan?
Ramesh's wife, newlywed wife came. She started cooking in her room, and suddenly, after 5 whistles, all the rice was in the roof of the room.
Rice was in the roof of the room.
She never had an idea how to cook the rice. That was Jane Ramesh.
Great memories we had, Mohan, with you.
Yes.
DBMF.
Okay.
Shall we move to the next video, sir?
Please.
Dinesh, can you hear me? Dinesh, can you hear me? Yeah.
Yes, sir.
Not too sweet. I'm happy. The packet and take-
Yes. Very nice, sir. The floor is yours.
Very impressive.
Khurshid,
Yeah.
Robin, we want to listen to you.
So the PGI is the only center, probably the only institute, which made all of us not only a good doctor, good human being, and a very, very complete human being, like various fields. Like if you look back in each one of us, it has actually brought so many things from us. And now we realize at this stage of our life that how important it was at those days. So the best part of my life was at PGI Chandigarh. I salute my colleague, my friends, and the institute, of course. Thank you.
Thank you.
Sir, any
I think,
anecdote you'd like to share about him? Any of his batchmates?
Yeah, I think I like to speak about Robin. I think one of the brilliant persons I came across in life. In fact, I knew about Robin. Probably he doesn't know it, even before he had come to PGI. And we, house physicians in PGI, would be informed that there is a scholar coming from Calcutta who has many, many medals, and he would be competing in the exam. So you be aware of that. So he had a reputation before he even entered PGI. I must say that after he entered PGI, and I don't know how we came in contact, but he gave me the first opportunity to become the mess secretary when he became he was a mess secretary, and he made me administrator of the mess. And that was the beginning of my political career. We did number of things together. Some of them were very good. In fact, I'll just mention two or three of them. One was that we used to have Punjab University students, and there was a problem that course was stopped, and then me as president and him as a general secretary, we were able to take it to some level to restart it, and his contribution is immense. And I think in PGI, I always looked at him as my elder brother, and because with all my antecedents, I would land up in trouble one way or the other, and he was always there to help me out and be a great sport. And one story I want to tell about Robin, and if you have the time,
Yeah.
right? This is about we were doing. We were both senior resident in cardiology ward posting, and one patient was admitted by the name of Butta Singh. He had a ruptured sinus of Valsalva into right ventricle. And in those days, we were not doing anything great. We were just doing catheterization of these people and sending them home. And because we were always short of beds, so there was always a shortage. How do we manage beds for Friday OPD? And this patient one day told us that he wants to go take a discharge for a few days and he'll come back. And we said we're very happy. And we discharged the patient. Patient went home, came back in another 1.5 months or so. We were still in the ward. And when he came back and got readmitted on Friday OPD with ruptured sinus, I also went to RV. Dr. Wahi admitted him. And a couple of days later, the police lands up in our CCU with warrants. With this person has been charged with 304, murdering somebody. And then the witness is Dr. Bali. And Dr. Bali has to go and give witness in Gurdaspur court. And those are the days when it was a terrorist time. And Robin came to my support that you can't go and give a witness in there. And young man in me, I said, I want to see how terrorists look like. And we were just talking about it. And Robin had told Dr. Wahi that, he should not be allowed to go. You should write to the SSP Chandigarh, preventing him from going to give a witness and all. And this person came up to my CCU, and SSP came first. And he said that we'll escort you to Gurdaspur court. And then this Bhutta Singh came sheepishly into CCU, and he says कि डॉक्टर साहब आप ये गलती मत करना, आप पुलिस के साथ मत जाना, आपको हम escort देंगे ताकि आपको कोई touch ना करे. So that was enlightenment for me. So thanks
So
to
nice.
Robin.
After so many years, yes, now I remember it.
Bhutta Singh and 304, I still. What he had done is, he had got discharged from their cardiology ward, and ruptured sinus have also into RV into heart failure, gone and murdered somebody, and come back and admitted. And he had said that the cardiologist will vouch for me that I'm so sick I can murder anybody. So that was the whole case he had done. So that is what I remember Robin. But I think
Thank you.
great man, and he's a great friend, wonderful person to have as a part of your life. And your contribution to cardiology is immense, and we are extremely proud of your progress. Very proud.
Thank you.
We
Thank
wanted to see him in politics, but that probably will come. They come.
Thank you very much. I think we should move now, Ajay.
Wonderful, wonderful, sir.
Yeah, talk about Dr. Bali.
Dinesh, next video, please.
Very nice.
Excellent, outstanding. I think one important point is missing here. I don't know how many of you know. He is an excellent cricketer. Excellent. I mean, he could have been in Indian Test team, Indian cricket team. He's excellent. So I think that must be mentioned about him.
I didn't know that. I didn't know that.
No, he is excellent, especially bowling. His bowling is very good. I mean, he deserves to be in the Indian cricket team. I remember, I saw him. I was watching. Outstanding.
Dr. Bali,
very
you
good.
were in the
Now you know
Ranji-
why I
Ranji
like Dr.
Trophy?
Robin Chakravarti.
No. You must watch him those days. The way he used to run and throw the ball. It was amazing. Very nice. So, and the remaining part is nothing. He's an outstanding person. The best thing about Dr. Bali is I think sure you all are intelligent people, but he's very sharp. He understands that what exactly has to be told and what actually has to. Suppose we talk, and he understands the meaning of the entire discussion, and he knows what he has to do after this discussion. Very sharp in decision-making process, which is very seldom these days. We don't find in everybody. That is an excellent quality, and that is the reason we always very intelligent, very sharp, and very quick to take an action. Very quick. So he was extremely helpful to me in many of the decision-making process during our association days. So
Can
many
I
of
add
them.
something? Can I add something?
Please go ahead.
Bali is a politician.
No, I think we are all in some way or other. But some way or other, yes.
Swings the
If
boat.
he was not,
Bali
if he
swings
was
the
not
boat,
in
both
medicine, he
sides.
would have been a politician. I don't know. Am I right, Bali?
I will tell you one thing.
I am I would say, political analyst.
Political analyst,
I'm
yes.
not a politician. I'm not a
You're
He's
not
not a politician. I'll tell you. Just to best listen to me.
But
During our AJD days, during the annual celebration, Bali actually got a nice suit stitched. That was a typical politician. This kind of, you see that picture is there which I showed, which I have shown. Like it is all the thing at the top. And Dr. P.L. Sharma, he was the dean, and he comes and tells, no, he is going to be future politician. But which is not. I was just laughing inside. No, because these are all young. He had a lot of he went and particularly got that suit stitched, and which is very nice. And that is the way. I think, but he's very good political analyst. Not only political analyst, I think an analyst.
Robin, but then during our meeting with our youngsters, I see many of those youngsters speaking vocal about Bali's, as a teacher, as a gifted interventionalist. That that was very, very gladdening to my ears. So I think rather than the politician, I will definitely want to mention, apart from his ball swinging.
I think I'll just add two lines. I have got a lot of love.
I have not. Did you mention the Kataria gold medal has been mentioned?
Yeah, that was a big moment of my life when I was
right. The Kataria, he got Kataria gold medal, which is the most prestigious gold medal of PGI Chandigarh. Bali got a Kataria gold medal from PGI Chandigarh.
Oh, great.
See, I have got great love and affection from my colleagues and students, and I'm very, very fortunate to get that. Problem is that of all the people here, I had the longest stay in PGI probably. So therefore, most of my life has been in public domain. So there is very little which you would not know. I only recite one share of Ahmad Faraz. I think Khurshid would understand that better, but I will translate it for you, brothers. देखो ये मेरे ख्वाब थे, देखो ये मेरे जख्म है, मैंने तो सर हिसाबे जां बरसरे आम रख दिया. देखो ये मेरे ख्वाब थे, देखो ये मेरे जख्म है, मैंने तो सर हिसाबे जां बरसरे आम रख दिया. Meaning thereby that my life, whatever good, bad, and ugly is in public domain. So therefore, there is very little to talk about it. And there are people who have great love and affection for me. And those are the things, those are my earnings, I suppose. And I think I'm very fortunate to have spent my time in PGI. I owe every little thing that I have achieved in life to my time spent in PGI. I came as a young person finishing his internship to PGI, and I think everything, right from academics to sports to culture to debates to whatever quote unquote politics, I learned in PGI, and that has stayed with me. And I think that has stayed with all of you too. You can take you outside out of the PGA, but you can't take PGA out of PGA.
No, impossible.
So I am very, very indebted to that. And greatest thing which happened to me was to come to PGI. And the greatest thing which happened to me was to interact with the resident doctors, because the quality which they bring to PGI and the quality of interaction you have with them enriches you immensely and adds to your growth, not only as an academician, but also as a human being. And that's the only part I miss, because PGI is because of the residents, is not because of the faculty. PGI is because of junior resident and senior resident from all over the country. The people who come here, I have not been to many institutes in the world, but I don't think any place can come very close to PGI as far nurturing the character is concerned. I am extremely proud of that. And knowing all of you.
Absolutely right. Absolutely on the dot.
That's right.
Thanks, sir.
Khurshid, why become so serious here?
I'm not serious. What you said is exactly, absolutely right.
I think
whatever
we can
can't
contribute
think of
back to PGI will be a great service. We owe it to PGI to continue to nurture it.
Right.
Wonderful. Wonderful. Shall we go on, sir?
Yes, please.
Yes.
Thank you very much. Really nice. But we'll request sir for some more anecdotes. I'm sure he has many more. Dinesh, are we ready with the next video?
Yes, sir.
Dr. Ghosh is a multifaceted diamond.
Absolutely.
Absolutely. Absolutely. So has he come?
I remember one day, I think he invited us for a cup of tea or something. I don't exactly remember where it was. It was his flat, and I saw beautiful, carved furniture. I was reminiscent of Kashmir art. I asked him, where from have you got this? He said, I have done it myself. He had done it himself. You can't believe such beautiful furniture, the chairs, the table. Then I knew he was a musician also. He would write also, and he was a great human being. He is actually, and he, in fact, had, I think, after MBBS, he had done 4, 6, 7 years, job in Delhi or wherever. So he started his post-graduation and postdoctoral much later. So wonderful person.
I mean, remember Khurshid, remember, we were about to leave, and that was the time Dr. Anand was hosting an international conference.
Yes.
Ghost, and along with Robin and Bali. But then Ghost was maybe the henchman for Dr. Anand.
You are
It was
right.
a
You
lot
are
of things to
absolutely
be
right.
done. Yeah, a lot of things to be done, and I still remember those.
I'll just tell a small story because Dr. Ghosh used to drive one Ford car. So it's a small Ford, not Ford. What is that? What is that called? Car. What is those days? What is that car? Do you remember?
Badal car.
No. His car was. What is that car? In India, we had that. What is that car?
Esteem or so?
No. Esteem was not there during our time. It was Ambassador. The other one was. What is that?
It must be
Fiat car. So he used to drive one blue colored Fiat car, and then one day I asked him, "Hey, boss, can I just borrow your car? I want to go for a drive." I said, "Okay, take it." So I took the car. I did not know how to drive actually. I drove it and then went straight to Shukna Lake area and hit the roundabout straight away. I hit. And then the car was in a different thing. And those days, I think he was with me. I said, okay, he was with me. He was sitting next to me. So, and I hit it. Then I felt so bad. And I'm so sorry. And I said, so what? It could have happened with me also. Don't worry. Don't worry. So generous. So I destroyed his car. But he did not scold me, did not feel bad about that. He said, oh, it could have happened with me. And I will never forget that in my life. This kind of person. And he was sort of senior to us by age, but a wonderful colleague, wonderful sort of batchmate to work with, and a wonderful person. And a lot of other things. And he's a good guitarist. He used to play guitar, which should have been mentioned. And he used to Dr. Bali has mentioned, cut his own hair, and there's a lot of things. And
I think Dr. Khurshid hit it on the spot, that he is absolutely a multifaceted diamond. He's a great cook. As he said, he can make furniture. He's absolutely outstanding cook. He makes furniture, artistic furniture. He stitches his own clothes. And as I said, he cuts his hair and his son's hair, and they were better than any salon. And absolutely a wonderful company to have. And he could narrate you great stories as well. And I wish he was here to tell us about his stories. He was the elder man in our group.
I think he has two sons. And a couple of times we have gone to his house. He has fed us greatly. And I think he has two sons, possibly two sons. I don't remember now.
Correct, you are right. Yes, Monu, you are right.
I think
one of them has become cardiologist, if I'm not wrong. One of them has become cardiologist.
So he has come to a couple of our conferences as an echocardiographer. That was the last time.
I called him also a number of times.
Yeah. It's wonderful.
Thank you. Very, very nice.
Dinesh, we have one more video, isn't it?
Yes.
Dr. Shetty, has he joined?
Is he still in the United States?
Maybe.
To US, and he's in Indiana now. And I thought he would have been here, but somehow I missed out. Spoke to him last week. Again, probably the most studious amongst the people I interacted
Very
with.
studious,
during
very
our
hard
time.
work. Very
Very hard
sincere,
work.
I think. Extremely sincere.
And it was very difficult to please him. There is a meticulous to the core. And
No.
I had a very close session because we joined on the same day, PGI as house physician. I followed him in skin and then in endocrinology, the two subjects which were said that if you get into house job into skin and endocrinology, you would not get into MD. So I followed him into that. And then we went together into medicine and DM cardiology. A wonderful person to know, a great interventionist. And I remember him delivering a lecture on carotid angioplasty stenting in one of the meetings. But I wish he was in India, but then maybe US needs him more than India.
I think he was in India, but then he left. What happened is last time, not last year, the year before, I was in TCT Boston. So I was just, there was a meeting and I was supposed to deliver a talk and I was just sitting there. And then suddenly one fellow tapped on my back. Hey, how are you? I turned around and, oh, it's Shetty. He said, what are you doing here? And I came back. Came back? Yes, came back. I left Bangalore. I say, is it? Oh, yes. Then we just had a nice chat, other kind of thing. So he's a very hardworking, very sincere, and I would say from his knowledge point of view, he's a perfectionist.
Yeah.
He used to, his cellular knowledge at cellular level was very, very strong. In library, we used to discuss, and I still remember that, initial days, I remember I did not understand much about preload and afterload. So it is Shetty who actually taught me that how you can recognize preload and afterload by clinical examination, which is very nice of him. Preload, and he made that concept clear to me. He is very clear in his concept, and he used to share his knowledge with all of us, which is a perfectionist. He's always, and he was never very difficult to make him happy. No, it should have been like this. Even if I say right, he said, no, it should have been like this, which is very nice. Very
Years
nice.
ago, when he was working at Columbia Asia, Bangalore, I have met him. But then that was long ago, and we didn't have the opportunity to see him again.
Now he's in US, I think. We'll try to connect. Maybe Dr. Bali actually, sometimes he calls the PGI, or contemporary equipment, and he does a lot of meeting. So that is an opportunity for all of us to meet our own sort of peers and others and have a nice interaction.
He worked many years in India, isn't it? I've seen him in many meetings.
Yeah,
So yeah, he was a cool guy, man of few words. So, he was very studious, no doubt about
very
it.
studious, very studious.
Very studious.
He used to stay in the library for late hours.
I think he was a favorite of PLW somehow. I don't know. We talk about him every time. Okay.
I think we should move now.
I think we've had a wonderful evening, and we really had a good time. This is not to say that you need to log off. Please carry on. It's been a real pleasure listening. For some urgent other problem, I have to leave. But please stay and chat for as long as you wish. So that's the formal part of our evenings. Really. Hello.
Yeah.
Maybe
when
Bali and once Smith comes back, we can have a physical get together during the India Live. That was the time when most of us meet.
Sir, that will happen. The India Live meeting will happen.
Okay.
Yeah.
Okay.
That will happen.
Yeah, please do that. That would be nice.
Of India Live. We'll find one day on which.
Is Miraji there, or Miraji has left?
It'll definitely. He's left.
Miraji has signed off, I think.
Nani has whisked him away.
Yeah, Nani was 6 months junior to us in medicine.
Nani later on did DM, no DM in chest, I believe.
She did DM in chest.
She was one of those first persons, who did
first few
pulmonology.
DMs.
Mohan, you don't want to tell any stories of us being your juniors in cardiology?
No. You chaps were exemplary. Where was, we were, me, Krishnan, Khurshid, Gurpreet, we were more of the oldies. You chaps you have the tremendous advantage of training in your having your MD training in PGI, and we guys was just there for 2 years, and it hit us actually. Now the teaching sessions, the CPCs, the statistical meeting. This was something unknown to us, and we were flabbergasted, what to say. But then those things taught us really well, and
Mohan, we are very proud of your registries which you have carried out in the systematic manner which you have carried them out. And I think you have set a bar very high for the rest of the people to follow. And we always look up to you from the academic point of view. Not from the political point of view. We look up to you.
But your contribution towards cardiovascular, your contribution towards cardiovascular academy, Indian cardiology is phenomenal. We all respect. We adore you for
it has given a boost. It has given a boost. Actually, others are following it now.
Yes.
There was hardly any such study from India.
Yes.
At that time.
The Khurshid, actually, I was working in a very small hospital. I was not even in an academic institution. The greatest support.
That makes it more important.
The greatest
more
support was your friends cardio. If you have a group, you can do anything. That is what taught me. A networking of 10 cardiology friends, we started it, we expanded it to 60, 70. So, we were very fortunate to have like-minded guys.
Great. And now you're doing infective endocarditis, is that right?
No. This is one of those registries. So I told, and I was about to tell BKS if PGI is don't. And it is very difficult to do infective endocarditis registry. So, but why we should, I may be wrong. It will be revascularization in a patient with LV dysfunction. Zero data from India. And we can definitely get it. All the PGI gets, guys. If we can also involve the surgeon, very good. Otherwise, just PCI or that will be wonderful. We thought about it, but
maybe we can definitely look at the retrospective data first, and then
why not?
Because
in
each
fact,
one of us would have a lot of
we have our own data from PGI published in Indian Heart Journal. There are some autopsy data as well. Mohan, Dr. B.N. Datta's publication a long time ago, I think sometimes in early 80s or late 70s, publication by Dr. B.N. Datta autopsy series of infective endocarditis.
I think Grover is the first author. I think that
Grover is the first author, yes.
Great.
Okay. We are trying to do, Bali, for the first time again, a polypill in heart failure. Oh. So we have one of those NHLBI grant guys from Washington University, and we couldn't get the DCGI approval from India. So we are doing a pilot study in Sri Lanka with no Arni, but DAPA, bisoprolol, eplerenone, and candasantan. Losartan.
Together, one tablet, one pill.
Just one tablet.
Which company is making?
No, this is made by not any company. We have a pharmaceutical agency, not a commercial one. So it was very difficult, but then with the help from these other guys,
these tablets are separate. They are being clubbed together in one.
All together in just one pill. In very many formulations, 1.2, 2.3 or 4 formulation. A tough game, but interesting.
It is.
Good innovative techniques should be tried, although the polypill did not work in coronary artery disease.
Yes.
But definitely the heart failure.
It worked, but it did not get the sale. It worked, Bali. It have a 31% decrease in the mortality, but nobody used it, mainly because of the problems innate with it.
No, and Mohan, there's another issue that, we are very commonly using these combinations.
Yeah.
If you look at the pharmacokinetics of these various drugs, we don't know how each one interacts with the other one. So therefore, internationally, or FDA approval, you would see very few combination, even as an antihypertensive. So unless we know that how different drugs are going to interact with each other when taken together, this concept would need to be tested. So
I mean,
pharmacokinetic.
we need more data. The poly-Iran was
True.
successful.
I think Indian
The
subcontinent, the
Chicago,
main
yeah.
idea is one is compliance, second is cost. These are the two
Basically,
issues.
yeah, that was the issues. Anyway, let us see.
But
Let
the
us see.
concept is great. Concept
Yeah.
is great because the
Concept is
compliance is going to be very good. And if the compliance is good, then definitely the outcomes are going to be
Right.
improved. Khurshid, what are your thoughts on cardiology going forward?
Regarding what? With the future or what?
Future of cardiology and
in the
interventional
future, artificial
cardiology,
intelligence.
structural heart disease.
Yeah, AI is going to,
Before you
influence
say I'm
every
making a
field.
political statement, I'm
There is
just
no doubt.
asking an academic
Leave
question.
aside AI. Intervention cardiology in India is expanding very rapidly. There is no doubt about it. Let me tell you, in my own city, Srinagar, there are now 9 labs.
Oh,
And yeah, and actually that's very good. We seniors, the older guys, are now relaxed. We were otherwise taxed, and we can take a break from rigorous hard work, and they're very good. They're doing a good job. So expansion to tier 2, tier 3 cities is going to happen. There's no doubt about it. Corporates are going to expand into tier 2, tier 3 cities, and it is needed. The way medical colleges have been opened in smaller districts, similarly labs are going to open there. So there is a future for cardiologists. I don't know why seats are remaining open now, but luckily in my state we are producing 3 DMs every year, right from 95 without break. So we are nearly 80-90 cardiologists that have been produced from schemes. And that is going to happen. That's happening elsewhere also, but somehow we are deficient. I think our country needs more cardiologists, trained cardiologists. Somehow people are getting, doctors are
Absolutely
getting this.
right, Khurshid. We have right now only 6,000 cardiologists in the
That's
CSI.
too small a number.
15,000 cardiologists qualified all over India when we try to collect the data. We need 48,000 cardiologists in India.
Absolutely,
That's
absolutely.
what. That's what. Anyway.
We are almost 1/5 what we should be.
true.
But in J&K things are a little better, and we have been producing more DNBs also now from Jammu Medical College and from Srinagar Medical College also, and some more medical colleges have applied for DNB. That will add to the pool, and it's a dynamic process. Doctors being produced, going out of country, coming back. But definitely cardiology has a future. It will remain so for maybe next couple of decades, maybe more. As regards the technology is concerned, that definitely is going to evolve. It's going to become better and better. New molecules are going to come. They are still coming. So there is no end to it. Only thing is we in India are a bit lagging behind in innovative technologies and innovative medicines. We are more into following West and Europe rather than producing something from here.
Our own.
Let me tell you, yes, let me tell you one thing. In 92 or 93, when I was quite young, I was...
You still look young even now, Khurshid.
No. The mind is young and you can do a lot of things. I designed a pacemaker. We had a problem, during the turmoil, the supply of pacemakers, be it temporary or permanent, they suddenly stopped because, The engineers left and so on and so forth, and we didn't get permanent pacemakers in time. So we had a lot of people on temporary leads, and they all finished. I mean, the temporary pacemakers, I think we were 4 or 5. So patients, the next patient would not get it. So he would be on isoprenylene. So mother is then, what happened is I went into finding out how these pacemakers are made. And those days net was very poor. And I designed three pacemakers, and I put them into use. And believe me, I presented the data in CSI in '92. And
Wow.
yeah. Designed it, made it. That is my hobby actually. This electronics has been my hobby from the childhood. And at that time, there was hardly any option not to do something. But somehow the tempo has not gone in the right way. We have been mostly
Ajay, I'm
working
running
in
out of
labs and
my battery in the mobile charge. It will disappear soon. So can
So
I
we will
meet
at Mumbai. We will meet at Mumbai
Right.
soon.
Yes.
Okay.
Okay.
Oh, yeah.
Thank you. Thank you very
Right.
much.
My
Okay,
absolute
Ajay.
pleasure to get in touch with you.
Pleasure. Thank
Sure.
you very much. Thank you.
Right.
Okay, Ajay.
Okay, Dr. Ajay.
Bye-bye.
Thank
Bye.
you so much.
Thank you. Bye.
Khurshid, we would like to listen to about your pacemaker one of these days, right?
Okay. It is still there. I took it along when I did a brief stint at Saudi Arabia. I took it along, thinking the hospital I'm working, maybe I can put it to use, because it was standardized and published, and it was not something which was, kind of, I had got it tested. So then I thought somebody might catch me what gadget I'm carrying. So I tried to find out how do you spell it and how do you name it in Arabic. So I wrote in Arabic alphabet. Came to know any gadget is called Jahaz there.
Mm-hmm.
So I wrote Jahaz bil Galb. Galb is heart.
Mm.
So somebody in the hospital looked at it. He said, "What is this?" I said, "No, I've just have just designed it and made it, and maybe someday may require it." But they already had a lot of temporary pacemakers. They are highly resourceful, and whatever pacemakers I did, the surgeon would make the pocket there. We were not used to that. We were doing ourselves everything in PGI and even SKIMS. So that is still lying with me. No, not required anymore. But I did present the data in one of the CSI meetings. It was, I think, in Delhi, maybe 92 or 93.
Great. Great.
That is it.
Let the patient keep on the patient. Tell me one thing. Are you in country on 1st and 2nd March?
Yeah.
We're planning some cardiology thing in Jammu. Okay.
Oh,
and
I
would like you to come over for a lecture.
That would be wonderful. Jammu, I love to be in Jammu.
And we would like our other colleagues also from Kashmir to come over. And I will communicate with them also.
Why don't you send me the flyer?
I'll do that. Tomorrow I'll send
it. We have a local meeting here on Tuesday.
Mm-hmm.
I'll announce it there.
Yes. 1st and 2nd, and I will just send you the flyer tomorrow.
2nd March. Okay. Is that a Saturday, Sunday?
It's a Saturday. So we'll have a Saturday evening program, and some felicitation of teachers and all those things, some culture program, and Sunday will be academics.
That would be wonderful. I will definitely join.
Great.
Send me the flyer because I will announce it in this Tuesday meeting. We are having we have about 2 monthly meetings of cardiologists, local cardiologists here. And तो मैं वहाँ announce कर देता हूँ. मजा आएगा.
कल भेज देते हैं. ठीक है. Wonderful. God bless you, and regards to everybody.
God bless you.
And I at least know everything to PGI. So great institute. Wonderful.
You know, are you going through this CPCs?
Not exactly, but I think I should start.
I think you should go, and you know, you feel
Sanjeev Bakshi is
as
very
if
active.
you are back into your
Okay, I'll do that.
PGI days.
Yeah, I miss two things. One is the lecture theatre morning Wednesday, CPC. And the other thing I miss is the gastro-radiology round of Madam Nagi.
Oh, I don't know about that.
Oh, absolutely. Fantastic.
Morning meetings are. I don't think there must be very few institutions in the world where
the carrying of that
such a
tradition
thing must be happening, you know, with so much punctuality
absolutely
for
start at 8
decades
o'clock.
together.
Yeah.
Maybe
Yeah,
some
that's
hospitals in US or UK. I don't think anywhere else.
Yeah.
It has, you know, if PGI was producing a journal like NEJM, and you would have a weekly.
They had, but it did not pick up very well. They initially had what was called as a bull PGI, bulletin of PGI.
Okay.
Okay, and there would be some very nice articles were published there. In fact, the Bhattacharya initial Bhattacharya work was published in Bulletin PGI. So
no, I know about that. I know about that.
I think Dr. Datta's work and all that.
DV Datta, and those guys in the pathology and gastroenterology, they had done phenomenal.
Dr. Koshi.
Yes, Koshi.
I think उसके बाद शायद खुरू ने भी वहाँ पे उसमें कुछ publish किया है.
Dr. Kuru and even Dr. Shaukat. Dr. Shaukat did compile the data on, you know, esophageal burns. I think corrosive burns. They had a lot of data which they were not able to write and compile and write. And Shaukat did it. And it got, I think, published in gastroenterology or gut, one of the top journals, US journals.
Where is Shaukat? He's still practicing?
Shaukat is here. He's doing private practice. He has his own small, you know, clinic where he does his procedures. चले मिलेंगे फिर मार्च में तो मिलेंगे फिर
कल मैं मिलता हूँ
ऑल द बेस्ट
ओके
ओके